Friends, welcome to my workplace at Ranaghat, West Bengal, India. In this video, we are going to see secondary implantation of a Sensar multipiece intraocular lens in the sulcus. The patient is aphakic. The previous surgery has been done long back, and now we have started the surgery. All the incisions have been made. Visco is being injected to make a space in the sulcus. There is a synechia at around 12 o'clock. I'm introducing a sense key hook to release the synechia, and this is probably a vitreous strand. I find that the anterior capsular rim is okay all around, and it can easily support a Sensar multipiece intraocular lens. I'm enlarging the main wound to about 3.2 millimeter so that the cartridge can go easily into the anterior chamber. This is very much necessary so that the leading haptic can go to the proper place. This is a Sensar multipiece intraocular lens placed in the cartridge. The lens has been folded, placed in the injector, and now it is to be implanted in the sulcus. The tip of the cartridge goes in. The cartridge is turned clockwise so that the opening turns to the left. And now the haptic comes through this. The haptic goes in the sulcus, and now the cartridge is turned anti-clockwise as the optic comes out, and slowly the injector is removed. Some visco is applied over the anterior surface of the intraocular lens, and now a McPherson's forceps is used to place the leading haptic in the sulcus, and the lens is nicely placed in the sulcus. And now I take a 23G Simcoe cannula, remove some visco. My plan is to apply triamcinolone acetate after removing some visco. Otherwise, the triamcinolone acetate will have difficulty in staining any vitreous strand if it is anywhere. No vitreous strand came to the tip, but we saw a tag at the place of synechia, so I inject an air bubble and then triamcinolone acetate. Now I use the 23G Simcoe again, wash out the particles of triamcinolone acetate. The tag is still there at around 12 o'clock. Next plan is to do vitrectomy, anterior vitrectomy. Irrigation is through the right side port, aspiration from the left, and I am walking at 12 o'clock where I found a tag while I released the synechia. It is very safe to use the cutter to wash out the visco. And now I am going in the antivitreous to remove a lot of visco that has gone to the anterior vitreous. Probably the previous surgeon did anterior vitrectomy, but because of inavailability of a proper intraocular lens, he chose to leave the patient aphakic, and that was a good decision. And here it is, the anterior vitrectomy is in progress along with removal of visco. And if we do this step, if we remove visco from the anterior vitreous, raised IOP will not occur because of retained visco. So this is a very essential step for any secondary intraocular lens implantation. Even for iris claw lens, after enclaving the haptics to the iris, we should go behind the IOL and remove the visco from anterior chamber with the help of a cutter in this way. So the antechamber and antivitreous has been nicely cleaned, and now I am going to inject moxifloxacin. I didn't ask for pilocarpine because I am sure there is no need of it. Pilocarpine may cause some inflammation in some cases, so better to avoid pilocarpine if it is not necessary. And now the side ports are closed, hydrating corneal stroma on either side of these stab wounds. And now is the time for the final lavage of the anterior chamber. Since we have removed all the visco nicely from the anterior chamber as well as from the anterior vitreous, see the intraocular lens is almost shining. And this is a bit of moxifloxacin as the last step. The intraocular pressure is on the higher side of normal as felt digitally. All integrity of all the wounds are checked and the case is concluded. Thank you very much for your attention. Hope this video will help you in developing your surgical skills. Always have a nice anterior vitrectomy system in your operation room. This will give you a lot of confidence. This will help you managing any complication of cataract surgery very nicely, and secondary IOL implantation will be very much in your list if you have a nice anterior vitrectomy system.